Welcome to Dentlecthub, your exclusive dental lecture series. Today's lecture will be on data collection. To begin with, why do we need to collect data? Because as Sir William Osler wrote, never treat a stranger. So make sure to collect as much as information as you can about the patient, the total history, and then start the examination. So how can you communicate with the patient? By listening to them carefully, showing them some empathy, and ask appropriate questions, open-ended questions, any questions that can help you to get as much as information from the patient, and make sure your patient has understood you well. Now, what are the things that you should avoid while talking to a patient is trying to use some scientific terms, technical terms, any colloquial words or slangs that can offend a patient. Now, what's the purpose of doing all this? To make sure that you've gathered all the information that's required to make an appropriate treatment planning, to prevent missing important findings that can affect your outcome of the patient. And every time you have a standard questioning format, it's always consistent and standardized so that the results are reproducible. And you also have a validity of your final treatment plan can get affected if your history taking is poor. Now, what are the methods of obtaining a patient history? It can either be a primary method and the method which you use for taking history, and the secondary method which can be an auxiliary method. So for the primary method, it's a standard questionnaire or form which we use to fill the patient case sheet, and the option second is patient interviews. In terms of questionnaires, the questions are fixed and the patient has to give a yes or no or answer to the point. But when it comes to a patient interview, you can modify your questions according to the patient. It can be customizable. When each patient is unique, it means that your questions also need to be tailored according to the patient. So your questions can either be an open-ended question, closed-ended, or a leading question. You can start the patient's history with an open-ended question as a casual question like, what brings you to the dental office today? When it comes to a closed-ended question, it's a simple yes or no. Do you have pain? Yes or no? So this helps the patient to focus to the actual complaint. And some patients can be very persistent or very introvert and not answering your questions appropriately. So that is where you can utilize this leading questions, something that has an answer within your question. Let's have a schematic way of trying to collect the patient information. So any patient, we start with the demographic data, which is identification of the patient. We identify based on their name so that it helps us in calling them, identifying the patient, and we record the age of the patient because certain diseases are specific to certain age groups. And then we record the gender of the patient. Again, certain conditions are more prevalent in male than female and vice versa. And we record the address for purpose of communication, and certain disease conditions can be prevalent in a demographic area. Say for example, fluorosis is common in places like Salem. And then we collect the phone number, which helps us to communicate further appointments with the patient. We also record the occupation because certain disease can happen in certain occupation or certain professions. Say for example, even dentists such as us, we can have any blood related pathologies, spine related issues, which is very commonly associated with our profession. And then we also collect about the physician's name and phone number to obtain any further medical history which the patient might not be very expert in explaining it to you. If there is any third-party insurance, that would be an added information, and if there is any national identifier information, that will also be an added information to your demographic data. Moving over to the chief complaint. Make sure that you will record only one chief complaint, which is the primary reason for the patient coming to your dental office. It must be recorded in the patient's own words in simple terms, and also don't forget to utilize the combination of open-ended, closed-ended, and leading questions to get the actual chief complaint of the patient. Now that you have the complaint for which the patient has come to your clinic, you need to know a little more in detail about the chief complaint, and that is your history of presenting illness. You need to know how it all started. So you can use the mnemonic, which is the old chart, which is the onset, location, duration, character of the pain, and then you have the habits associated, aggravated, relieving factors, and the time since it all started. So this is the old chart format, and I have an example for you to look at. Now moving over to the medical history. I know that we are dentists treating only the mouth, but we also have a famous saying that mouth is a mirror of the body, and we also know that any dental treatment performed on medically compromised patients can be risky. So it is very essential that you have a complete medical history of the patient, including their illness, their medications, their previous hospitalizations, and anything that might affect our dental treatment. To memorize the medical history more appropriately, to make sure that you've not missed out on any systems, I've classified the medical history on alphabetical order. So to begin with, A stands for allergies or anemia. Allergy is a very important question to ask because they can be allergic to any of the dental materials such as even latex. And then anemia is again very important because anemia is a condition which can be a contraindication to general anesthesia. It can have some oral side effects such as candidiasis or sore mouth. And then moving over to B, standing for bleeding tendency. Any invasive procedures or anything as simple as scaling can aggravate their underlying bleeding condition, and they can also be a contraindication to our routine dental prescriptions of aspirin and NSAIDs. Moving over to C, standing for cardiorespiratory disorders. Patients with various cardiac conditions can develop any of the bleeding disorders. They can have endocarditis risk, and they will be on multiple medications which can cross-react with the medications that we are prescribing as dentists. Next, D stands for any drug use, allergies, or abuse. So there are possibilities that we are prescribing the same medications as a general physician when it comes to antibiotics and painkillers. So make sure that we take a proper drug history and we avoid a polypharmacy. And then the drug allergies, another important concern where we prescribe medications such as penicillin and amoxicillin, which are generally a most common cause for drug allergies in patients. Moving over to E, standing for endocrine disease. Two most important endocrine conditions that can affect when we are treating dental patients is diabetes and hyperparathyroidism. Diabetes because there are several oral complications. There could be gingivitis, periodontitis. Patients can be prone to dental caries, and it can also impair the wound healing, meaning the patient can have a delayed wound healing after extraction. When it comes to hyperparathyroidism, they can have jaw radiolucencies, giant cell granulomas, and we must be careful about the risk of fracture during a traumatic extraction. Moving over to F, standing for fits and faints. If the patient has a previous history of fits and faints, then it is very likely that the patient develops the same during a dental procedure on the dental chair. Moving over to G, standing for gastrointestinal disorders. History of nausea, vomiting, diarrhea, or anything that is related to GI can get aggravated because of the NSAIDs that we prescribe as painkillers for dental related pains. So make sure to take a proper GI history. And the same GI conditions can also have any related oral manifestation. H stands for hospital admission, attendances on operation. This means that the patient might have some severe medical illness which needs attention and which they overweighs more than the dental treatment. If the patient is medically compromised, hospitalized recently, and that requires more attention, then we look into something called as risk versus benefit ratio, where we might have to postpone the dental treatment until the medical issue is resolved. I stands for infection. Now, this is something very serious because the infection is not only affecting the patient, it can get transmitted to the next patient, to the surroundings, or even the doctor ourselves, because infection can be spread through bloodborne or respiratory mode, which is very significant in terms of dental office. So make sure to record history of hepatitis B, HIV, any recent history of flu, COVID virus, any tuberculosis, anything that can be transmissible and dangerous. And then moving over to J, standing for jaundice and liver disease. This is important because these patients are more susceptible for bleeding tendencies. They have drug intolerance because most of our drugs pass through the liver as for the first pass metabolism. Moving over to K, standing for kidney disease. This is significant and important to record because, again, just like the liver disease, the patients also tend to have bleeding tendencies and impaired drug excretion. The other problems associated in patients with kidney disease is immune suppression, especially following a kidney transplant. And if the patient is going to be on dialysis, then we have specific precautions for the same. And coming to the next, which is the likelihood of pregnancy. Any women in the childbearing age, this question cannot be avoided because of the risk of abortion, teratogenicity, especially in the first trimester. Technically, the second trimester is considered to be safe to treat during pregnancy. Still, this history must be recorded. And finally, we have M, standing for malignant disease. Any patient who is having malignancy, even if it's not in the oral cavity, it is important to record this because these patients will be on chemotherapy and radiotherapy who will have associated symptoms on the and oral complications that can happen. And this might affect the outcome of our dental procedures. This is a quick table for your review to ask questions in each and every system. It is very unlikely that the patient knows the exact medical term of their condition. You cannot expect a patient to know that he has chronic obstructive pulmonary disorder or a heart murmur or atrial fibrillation. Rather, you can ask some simple questions. Do you have difficulty in breathing? Do you have any history of fainting? Do you have any history of having a fits? Some simple worded questions which can help you to identify which system is affected. It is essential that you ask questions about past dental history. It's not just about the treatments that you have done, but also if any complications that has occurred following dental treatment. This history will help us to understand or get an idea about the regularity of attendance for dental care and attitude of the patients towards dental professionals and to the treatment. And if there is any recent relevant problems, this will help us to tailor the upcoming appointments and treatment plan. When we are talking about the social history, you should ask them questions about their socioeconomic status, any recent history of travel, what's the amount of family support that they have to come to a dental appointment. Believe me, this can be a very tricky question. And also you will have to ask questions regarding their habits, the parafunctional habits, the kind of diet they have, and everything will influence their oral hygiene. So if it is habits specifically, you need to ask questions about tobacco, alcohol, betel nut, any recreational drug use, specifically on about the duration of use, the frequency of use. These are some questions which are very significant in a patient's social history. And finally, it comes to the family history. You will ask questions about any family who are in direct contact with the patient and any blood-related family history. So a patient, I mean about the people who are living in the house of the patient, and also about the blood relatives, which is the mother, father, brother, sister, and children, so on. So why this is important to ask? Diseases can spread from generation to generation, which can be a hereditary problem. It can be because of a contagious infection, such as a familial outbreak of infections, or it can happen in some certain specific ethnic groups. So these are some of the conditions which runs in the family or which are contagious, and that can significantly affect the health of our patient as well. So dear students, that's it for today. It's a very simple but very important lecture that you must know in a daily practice. I will come back with more useful videos. If you have any doubts, feel free to question in the comments below. I will try my best to answer you. Until my next video, don't forget to like, comment and subscribe. All the best.